I will discuss about diuretics. What is diuretics? Diuretics. Okay. Diuretic drugs are also called water pills. Water pills because it decrease reabsorption of water inside a body. All the diuretics has the capability which decrease the absorption of fluids inside a body is called diuretics. Basically, the diuretics is used for the pre-hypertension stages. Pre-hypertension stages. Pre-hypertension stages also. Majority of children have hypertension problem due to kidney problems. Infants having problem of hypertension due to renal diseases. Okay, so we have these terminologies that the pre-hypertension stages we are giving the specify the diuretic medications, and the majority infants having the hypertension problems due to renal problems. Okay, it is a short clip, and also I will classify the diuretics different types. Okay, different type of diuretics. Number one, we will discuss about the thiazide diuretics. Thiazide diuretics. Number second, we have loop diuretics. Number third, we have case pairing diuretics. Number four, we have carbonic anhydrase. Okay. In the thiazide diuretics, we will discuss about respectively all the thiazide diuretics. We will discuss about the loop diuretics. We will discuss about the case pairing. We will discuss about the carbonic anhydrase. So these specifically medications and classification we will discuss here in this short clip of video. Okay. In thiazide diuretics, we will discuss about the medications having hydrochlorothiazide. Okay, hydrochlorothiazide is a strongly contraindicated in gout patient. Okay, because it increases the uric acid level inside a body. Okay, it increases the uric acid level inside a body. So due to these reasons, we will discuss it further. Suppose to say we have these thiazide diuretics. What it will cause inside a body? It will cause hypokalemia, hyponatremia, plus hypercalcemia. Okay, it will cause hypokalemia, hyponatremia, and hypercalcemia. Also, the thiazide diuretics having the capability which is decreasing the potassium level inside a body, which has the capability to decrease the sodium level inside a body. It increases the calcium level inside a body. So we can say to it that it causes the hypokalemia, hyponatremia, and hypercalcemia. Okay, but these drugs, hydrochlorothiazide classification drugs, is strongly contraindicated with gout patient. Okay, gout patient. Why it is? Because by the uric acid levels increase by the oxidase, xanthine oxidase enzyme inhibit by enzymes. The xanthine oxidase enzyme has the capacity to increase the uric acid levels. So here, this thiazide increase these enzymes levels, so it increase the uric acid levels. So this drug and medication is strongly contraindicated in gout patient. Okay. Another we have a case pair loop diuretics. Loop diuretics as we will discuss about two drugs. Number one, furosemides. Number second, bumethanides. Okay, furosemides cause the metabolic acidosis. It will cause the metabolic acidosis. Okay, and another one, bumethanides, cause ototoxicity. Okay, ototoxicity. Okay, but another one, the loop diuretics, is causing decreased level of potassiums. It's decreased level of potassiums. It decreased levels of magnesiums. So it is called hypokalemia, hypomagnesia. So also these drugs, this classification drugs is safe drugs inside renal problems. Okay, renal disease problems. A patient having renal diseases, so these loop diuretic drugs, refurosemide, bumethanides, we can give these medications to a patient having the renal problem also. To the renal problems, first the renal patient having the renal impairment, so we can give these loop diuretics medications. Okay, another one is also heart problems, pulmonary edema problems or pulmonary problems, we can give this medication to a pulmonary patient for the renal, pulmonary and for the heart diseases. So this drug is a safe, or this medication furosemide bumethanides is safe drug in renal impairment patient, in pulmonary pulmonary patient having pulmonary edema patient, and also having a heart problem or the cardiac problems. Okay, so this medication loop diuretics is also safe in renal impairment, pulmonary edematic problems, and also for the heart diseases problems. Okay, it is caused metabolic acidosis, and also furosemide causes metabolic acidosis, and bumethanides causing otoxicity. Okay, the case-pairing diuretics, it is a very dangerous drug. Okay, by the case-pairing diuretics, case-pairing medications classification is called the spironolactones. It is for the antagonizing properties of aldosterones. Okay, so this drugs is causing hyperkalemia. Okay, but this hyperkalemia leads to a patient to the death, to the age of the death. So if you have increased calcium levels inside your blood, so it will cause your death positions, or it will bring you to the age of death. Carbonic anhydrase is acetazolamides. Okay, acetazolamide medications is acetazolamides. Acetazolamide is having a very good function inside in a glaucoma, pulmonary edema, and like this type of problem. So acetazolamides having a good efficacy inside a glaucomic patient. So it is a short or long classification of the thiazide diuretics or the diuretics. Diuretics are basically called the water pills. It inhibits the reabsorption of fluids inside the body. Thiazides, loop diuretics, case-pairing, carbonic anhydrase. In thiazide, we discussed the hydrochlorothiazide. It is strongly contraindicated in the gout patients. It increases the it decreases the potassium level, sodium level, and it increases the calcium level. It is causing the hypokalemia, hyponatremia, and hypercalcemia. Also causing the loop diuretic medications having the furosemide, bumethanides. So it is having the hypokalemia and hypomagnesia. Also these medications having this type of medications having the metabolic acidosis, furosemide, and also another one's the bumethanide causing the ototoxicity. Another one is also the case-pairing diuretic spironolactones. It is increasing the potassium level inside the body, so it causes the hyperkalemic conditions. So it leads to a patient to the age of death. Another one is called for the carbonic anhydrase is the acetazolamide is a drug of choice here. So acetazolamide is using for the glaucoma patients, pulmonary edemic patients. So this drug, it is the short or the long classification of the all diuretics. We will further discuss this disease by the respectively by the medications aspects. So these are my short clip on the diuretics.